It's my pleasure to introduce our next speaker, Maria Fusco. She's the Chief Conservator and Margaret Wayne Dog Chair of Conservation. Since 2016, Maria has led the Conservation Laboratory at the museum's Avenue Foundation Conservation and Collections Resource Center, where she has expanded the department's role as an international leader in textile collections care. With a background in biology from the University of North Carolina, Chapel Hill, and a master's in textile conservation from the University of Southampton in England, Maria brings both scientific rigor and deep practical expertise to her work. She has trained and mentored the next generation of conservators through various fellowships, and she continues to train emerging and established professionals in the field. Please join me in welcoming Maria Fusco, a dedicated conservator, mentor, and advocate for excellence in textile preservation.
Good morning. Thank you for such a nice introduction too. My name is Maria Fusco. Actually, I was introduced properly. That's a proper Italian way to say my name. We say it wrong, so thank you. But I'm an art conservator. I'm head of a conservation department, and the museum I work at was a private museum in sort of the Embassy Row section of DC for about 90 years. And then we moved to George Washington University about 10 years ago. So we have a lot more resources at our fingertips, which I'll talk a little bit about today. And I'm speaking today about occupational health concerns in museums. If you don't mind just advancing the slide. Is this the best way to do it? Can you just say like next slide?
Sure, that's fine.
Or is there?
Yeah, there is a clicker.
You may ask why museums. So I'm going to cover that and explain what professionals and community members are at risk. I'm going to go over what our concerns are as we can identify them, and we need help in identifying them often, and what we're doing about them currently. Occupational health and safety has been a big focus for our museum over the past 2 years, and I'm going to detail that as a case study. And I'll wrap with areas that OEHS professionals can get involved. We've already been engaging, but the longer I go, the more I realize there's more help we need.
Maria, is it on the side? Is the power on? I can't.
Yep. Let's see. I share a little of my personal history. Is this kind of gives a snapshot of daily and annual risks we encounter. And my boss told me I was burying the lead as well, so that was helpful. So just snapshot for me to give you kind of drive it from this current job I'm in. I started in July of 2011. My first week on the job, I was carving a display mount out of epitome for a hat, and the blade I was using slipped. I cut my finger and I had to go to the ER. So our finance director was not happy, but that was just the first week. Within my second year there, I had a rotator cuff and bicep tendon sprain from moving boxes, holding collections objects by myself. The field is persistently understaffed, so we're often doing solo tasks like this. In my third year at the museum, I had a pesticide exposure while pregnant. A contractor was humidifying a textile a room away, but a smell came off of it as she was humidifying it. We both became nauseous, lightheaded, had headaches. Pesticides were in the past applied proximate to or directly on textile, paper, natural history collections, amongst other types of media to prevent pest damage. And just 2 weeks ago, even though I was all PPE'd up, I had an acute reaction to a proposed collection donation, a 19th century rug. My eyes were stinging and burning, likely a pesticide residue. So this is just one staff member, and aside from perhaps indicating a slightly clumsy individual, this highlights the risk existent in our museum work and environment. Given the wide swath of professionals, community members, and the public that come into contact with historic materials, a colleague textile conservator recently characterized these pesticide residue concerns as a public health crisis, and I agree. I'm going to share some more details today, but hopefully drive the point home. Museums may seem like sterile environments, but it's far from the case. In preparing objects for storage, we rehouse and build storage mounts. And preparing objects for exhibit, we treat objects and we build more mounts. For these mounts, we use blades, power tools, including saws, and work at height to install mounted objects. And here are some examples just from our museum of these activities. Focusing a little more on what I know, and I'm sorry, I think some of my font got a little out of sync, but hopefully you can read it. Art conservators within our sphere, we research the material composition and maker practices on objects. We use instrumental analytical tools for this, some of which employ X-rays and UV light illumination. In treating, which is cleaning or repairing objects for exhibit, we sometimes use chemicals, and this varies among media types. So here we try to increasingly make conservative choices. We're using much less noxious solvents than we did in the past. But sometimes we don't always have that choice about the chemicals we interact with. One example is the pesticide residues I mentioned on collections objects. I'm going to focus a little more on this type of hazard in this presentation as it's the one I know best. In some conservation practices with some media, particulates are an issue as well. So here at our museum, making metal mounts, which is the bottom right slide, sanding some metal there. With some conservators, they work with media types of stones, ceramic, metal, and cleaning these media can also introduce risk. It could help to start with whose safety we're worried about, and it's a mix of professionals, community members, and even the public. What professionals, existing cultural heritage, and what do we do? It tends to be the people who are art collections and historic collections centric who are most exposed to risk. At risk from these collections themselves, from processes needed to care for them, to use them, to educate. In increasing cases, risk indirectly using these objects, because in cases where important items were taken from cultures without their permission, objects are being repatriated, and there's an understandable desire to use the object, especially when these were ceremonial or of great cultural importance. The way a museum views an object is often fundamentally different than the maker or the community is from the way they viewed it. So more on that in a moment. The top right are some staff in museums who are most collection centric. So to be curators, conservators, collections managers, registrars, exhibition production, art handlers. Many museums have education collections which are used to teach and may be accessed by the public. These are often populated by objects which were not accessioned but still held, so they come from the same donation sources sometimes. Not all curators, collection managers, conservators, art handlers work in institutions either, so many run their own private practices or consultancies of one, or small groups for hire. They are equally, or at times more so, at risk. They work with private collections, small historical societies with less of a safety structure and safety net. There are other groups on the front line, so to speak. This is an area in which I'm only beginning to learn, and I'm not an expert, but it's important to make you aware. Repatriation may be a term you've heard of. In the U.S. enacted Congress in 1990, NACRA provided for the protection and return of Native American human remains, funerary objects, sacred objects, and objects of cultural patrimony. Within and beyond legal requirements to repatriate cultural patrimony, there is increasing recognition of the ethical need to do so. Processes of shared stewardship and voluntary returns exist in this area. Voluntary returns are when museums, universities, libraries, and other institutions proactively return cultural belongings, human remains, sacred objects to Native nations and communities, even when not legally mandated. This is ethically driven. Shared stewardship is a concept that in advance of communities receiving back cultural materials, a collaborative relationship should exist between the tribal community and an institution currently holding their cultural items, making decisions together on care, management, and interpretation of cultural materials in ways that honor both tribal sovereignty and institutional responsibility. So when we consider potential pesticide residues on cultural objects and they're returning home, we have an obvious health concern to communicate. In terms of who may be receiving and handling and using returned cultural patrimony, there are a range of groups and individuals, such as listed on the right. And again, this is an area in which I'm still kind of beginning my education, but I want to introduce this as additional areas to consider. Tribal museums will have collections-oriented staff, just as in non-tribal museums. So you see familiar names here: curators, collection managers, registrars, conservators, exhibition production. Though the smaller museums won't have all these staff. You may just have a curator, you may just have a director who's wearing many hats, both in tribal and non-tribal museums. There may also be administrative groups or groups which include community members who receive and manage these objects or who have involvement in the process. And sometimes when the original maker can be identified, an object is returned directly to the family. The health concerns inherent here are a concern to the museum community, and there are efforts being made to mitigate risk and to communicate risk. And as mitigating and communicating risk are what OEHS professionals do routinely, we are seeking more engagement. So I introduced some of our health and safety concerns broadly, but now a bit more detail on these concerns, and they fall into these categories, in my opinion: physical risk, chemical risk, and instrumental risk. Physical risk, what might be classified as safety. We need to carve ethafoam, which is an archival quality hard-celled styrofoam, to make small internal support structures for objects. It's one example. We carved down fiberglass mannequins and dressmaking forms to display historical costume, because body silhouettes were much smaller in the past. We used saws to cut storage tubes, saws to cut exhibition hardware like cases and platforms and sand them. I use a saw on a regular basis at work. And we were pretty good about hearing and eye protection, but particulate protection we're a little oftentimes less aware of, and less apt to protect ourselves from. We move objects from storage sites to gallery sites and within these buildings as well, physically picking up and carrying, often with one partner walking backwards. Sometimes these boxes are heavy. Many objects displayed in galleries are large. Some require the use of personnel lifts. We're up on these lifts quite a lot, or ladders to install. Particulates are encountered between stone, metal, sculpture when excavating artifacts and processing them. And silicosis is not much talked about. And again, another example of working at heights here. I spent a lot of my time up on a ladder or crouched under a table or walking backwards holding something heavy, and then using blades and using saws and power drills for someone with a chemistry degree. And that's not uncommon. We also can use chemicals, solvents in treating, cleaning and repairing objects, in applying, activating, or removing adhesives. These are instances where we make known chemical choices. And these have become increasingly conservative over the years, so less noxious solvents. We learn to store our chemicals safely, to retain SDS sheets to dispose of chemicals properly. However, a troubling source of risk is in the unidentified chemicals we sometimes, in the case of our museum, often encounter. Chemicals that are complex to identify, sometimes impossible to identify, often expensive to identify. And here I'm talking about pesticides, inorganic and organic. More on this in a moment. We also research our objects to attempt to answer questions about what this was made of, when this was made, and how. We use analytical instruments for this. Some common ones employ X-rays or UV illumination to image objects or to identify their material components. Here we might be trying to understand the internal structure of objects. So the top left, they're X-raying a thick composite object, or identify a pigment, paint, which is the top right, or a dye. So the bottom left is our museum, and we're trying to identify dyes there with an imaging setup. The bottom right, I'm trying to identify heavy metals in book bindings from historic books. So how good are we at being aware of and mitigating these health and safety concerns? It varies. Physical hazards, I highlight physical hazards here as it's not often well trained on in the museum environment. We generally receive little to no training or written guidelines. While we work with these tools and heights, and sort of at heights daily, this is often less on our radar as a source of risk. We just kind of power through. Conservators who work with metal, stone, and who work to process excavated material don't seem to, across the board, always look to PPE to manage risk. For instance, wearing respirators, so this is changing. I've seen a big acceleration in this in the past few years, especially amongst emerging professionals, so younger professionals. Chemical hazards are a little more on our radar. We use chemicals in treatment. And so in our program training, we get some lab safety training generally. But once we're working, there's varying degrees of support. So some places there's no training at all, smaller institutions. Some places you're routinely trained on chemical safety, especially when you work at a university museum or a federal or state museum. We have some experience in chemical storage, retention, and review of SDS sheets. We generally have some increasingly there are health and safety groups within our national professional organizations. But many of us who work on textiles, paper, and natural history collections will also encounter unknown chemicals in the form of pesticide residues. There's a lot of collections that pesticides are applied to more than you would think, and we're learning more as time goes on. And there are real long-term health consequences and a building engagement on this topic for museum staff. And indeed, a need to engage in this topic relative to repatriation and a duty of care and communication of risk. There's not always fulsome coverage in our training programs either on these risk factors. There is some, but I still find a lot of emerging professionals coming out not very well exposed to some of these safety concerns. So that is something that would be great change in our field as well. Despite efforts in the late 1980s and 90s by museum health and safety pioneers, so Nancy Odegaard of the University of Arizona is one. There's not been significant process in museums until really recently, as the past 5 years or so. Even with this progress, many institutions stall in testing, and testing is limited at that, or we have limitations in doing that. We get crippled by the information we're receiving and knowing how to use the test data. Instrumental risks, so there's generally pretty good awareness of the caution needed with X-ray and UV generating instruments, but not all institutions will have internal safety staff, and museum staff may be on their own to implement safe practice, training, and monitoring. I want to go into detail on one risk type. This is the one I know most about, and one with building interest in the museum and tribal communities. Many types of art historical collections are susceptible to pest damage, and predominantly historically common sense measures were employed. One was to use mechanical methods, like cleaning, monitoring, going through areas and looking at pest traps, and then biological means of control as well. So, pest control using animals. Using biology rather than chemistry. So it was very much emphasizing prevention rather than cure. The museum field is returning to these practices now, increasingly so since the later 1980s. We monitor, clean, and prevent pest intrusion. We preventively treat for pests using freezing and anoxic processes, which leave no residues and are generally more effective. But for a long time, chemicals were used to control and eliminate pests. I did a little research before this presentation, and pesticides were used as early as in ancient Mesopotamia and Sumer, using sulfur compounds. China, 1200 BC, arsenic and mercury compounds. The ancient Greeks also used sulfur. More recently, in the 17th and 18th century, people used plants like tobacco, herbs, but also arsenic continued to be commonly used. The 19th century, there was a greater interest in inorganic chemical pesticides containing arsenic, copper, and sulfur. And then with kind of preparations and buildup, and during World War II, the modern era of synthetic pesticides began. Use of DDT and lindane and aldrin. Practices in agricultural control of pests were adopted by collectors and museums. Pesticides were applied proximate to or directly on collections objects in liquid or solid form or volatile forms, often leaving residues. Pioneers in the field of museum health and safety in the late 1980s and 90s sounded the alarm. So I'd just like to give a shout out to Nancy Odegaard, Marilyn Poole. But it's been hard to sustain such efforts for a lot of very practical reasons. In recent years, there's been a building use of portable X-ray fluorescent spectrometers, which we've adopted from other industries, helping museum staff identify elements which indicate inorganic pesticide use. So the presence of arsenic, mercury, lead on objects which do not include such metals in their original fabrication. This has increasingly been the subject of conference talks and building online resources. A lot of data providing a lot of information, but here's a few specific entities who are helping build this focus within our community. Some are sharing information and educating, others are directing collaborative projects, others serve as ad hoc community forums to discuss concerns. So AIHA is the American Industrial Hygiene Association. They have a specifically focused museum working group. There's also a repatriation-focused museum working group with a subgroup of XRF users working as standardized practice. There's a DIS list for librarians working with rare book collections, which contain book bindings colored with heavy metals. So this is a Victorian and Edwardian practice, using arsenic to create beautiful emerald greens, lead and chromium for more brown yellows, and with an affiliated project of the University of Delaware. So welcome to look up the Poison Book Project online. Our Conservation National Working Group, the American Institute of Conservation, is organizing efforts as well, including a pending safety course. They just received funding for, and they're organizing that. The foundational arm of AIC, which is called FAIC, has a Connecting to Collections Care group who put on educational webinars on many topics, lately covering pesticide concerns. Tribal museums and collections are organizing efforts as well to advocate for themselves and each other and build safe practice internally driven by their own needs. On the left, an Indigenous collection care guide has been developed collaboratively by tribal community representatives and museum professionals. Its aim is to, quote, provide a framework to respect and recenter collection stewardship practices around the needs and knowledge of Indigenous community members. On the right are two presentations at the recent Association of Tribal Archives, Libraries, and Museums conference on the topic of managing pesticide risk. One case of an institution moving to mitigate risk is our museum. So I'll just share as a case study. 2 years ago, we began to assess risk in our museum and moved to manage it. We tested our multiple collections, our main exhibited collection, but also our education collection, which is used in public demonstrations. Also the rare book collection in our library, testing the bindings for heavy metal colorants. In-house, we're only able to test at the elemental, not compound level for inorganic pesticides, arsenic, mercury, lead. We partnered with our university's health and safety department and OSHA via Virginia's Occupational Safety and Health Department to test our workplace. We tested the surfaces of our treatment and work tables, which come directly in contact with the collection's objects, so that's there on the left, and surfaces in less direct contact, storage shelving, drawers, the top of transit carts. So that's the center and right image there. We also tested more removed surfaces, common touch surfaces like the keyboards of personal and shared computers, door handles, floors, and even the break room. In asking for this, I thought I was being a little paranoid, but I had a little spidey sense, and I'm glad I did. So we were really trying to be as wholesome as possible and stretch out as far as we can in testing. Personnel's breathing spaces were also tested while they went about their normal work day. So there's a list of who was tested and what we were tested for, and then the monitoring apparatus we wore. Our OEHS partners educated us on the hierarchy of controls, and we implemented controls custom to our workspace. So we came up with controls and we vetted them by our OEHS partners. We tried to take better advantage with installed air extraction systems, attempting to increase hand washing access, more formalization in cleaning routines, and segregating electronics, personal items, documentation tools, which are moved around the facility from surfaces the collection's objects are on. Also making sure PPE is always to hand and plentiful as our cleaning materials to remove any barriers to compliance. And that's really just to make it very easy for all of us. Everyone gets very busy. It's very easy just to skip over things, but the more it's right in your face, it helps us a lot. We developed signage to draw attention and reinforce safe practice. So on the left, a little door handle cleaning sheet that we have at our doors is just printed out paper, laminated, and use dry erase markers. So some really simple, cheap, effective measures. We label tested objects and document this testing in centralized locations like our collections database on the right. And then we've done labels too on work surfaces or non-work surfaces, actually, where we should have instruments and just reminders to kind of clean these common touch surfaces frequently. We've standardized PPE and trained on donning and doffing as well. Our University Health and Safety Department helped us throughout. We also accessed free consultation and testing services from OSHA via their state partners, in our case, Virginia Occupational Safety and Health. They guided us in developing a formal health and safety plan. Our HASP covers physical risk and chemical and instrumental risk, and we've begun training staff on it. We've also begun sharing what we've learned to guide others. We've organized a series of case study presentations of museum and tribal representatives attempting to build similar safe practice. And the Hopkins ERC has been our partner in this series. We're creating an abbreviated guide on how to build a safety program as well. It's currently in an early draft phase, and we're presenting on this process at conferences to get input and review. We have really benefited greatly in our museum has by getting to know OEHS professionals, first industrial hygienists, and subsequently epidemiologists. We're learning, though, that a full safety response requires a multidisciplinary team and would benefit from the expertise of toxicologists and occupational physicians as well. So if you have interest in supporting our communities, there are many ways to learn more. Presenting at our conferences or letting us present at yours, such as right now. Joining our already active working groups or forming your own within your own professional communities. Connecting with our AIC Networks Health and Safety Group. There's also a separate nonprofit called Safety for Nonprofits. They are entirely a volunteer community that advise a number of businesses on safety matters. And if you're interested in any of this, just reach out to me. You're welcome, of course, to collaborate with our team, which at the moment consists of a registrar, conservator, a couple of industrial hygienists, and an epidemiologist, but we're always looking to build our dream team. So it's a little jumbled. Hopefully you can see my email, but if you have any interest in learning more, please do reach out, and I'd be happy to connect you with any of these active groups. And thank you for listening.
Any questions? I'll ask one. Can you take me through what happened after you had the exposure? How did that proceed?
I had one when I was pregnant, and then one a couple weeks ago. So they were pretty different, just because one was before we had built up much of a practice, and this last one is a good way to test out our response, I guess. So yeah, the first one, we had just come to the university, and I and the contractor had this reaction, and we tried to reach out to our health and safety department at the university. They were really understaffed at that moment, and we got a bit of a response, but not as much as they wanted to, I think. They did talk to me a little bit. It really was a lot of me looking into things on my own. So I found the National Pesticide Information Center. They're out of Oregon, one of the universities. There's a free resource. So I talked to them at length. They reassured me quite a bit on just the, biological separation of what a pregnant mother is breathing in and how that's filtered to the baby. But really, I was scrambling to find a lot of my own resources. And then fast forward to 2 weeks ago, I was able to implement our safety plan. So we have in our HASP, we have a section about incident reporting. So I did that. I followed all the steps. Our University Risk Management Department got back to me immediately. They asked for more information. I filed the report. They've created a non-injury claim with our insurer to document it. And then our Health and Safety Department is a separate department. Got back to me to make sure there was no, lasting ramifications. And then we began internal discussions within our museum, and we've gotten further consultations from health and safety. So now we have a lot more support. I have people to go to, but a lot of museums and a lot of communities don't have this. So that's where we're trying to build up these groups that can help advise, resources so you can go educate yourself as well. But a lot of people are on their own to address these things in smaller institutions.
So your symptoms got better relatively quickly.
Yes. Yeah.
But if you were coughing, short of breath, do you have access to medical provider? Or is there a process that?
There is, we're building that out now, sort of how we would go about if we needed to access occupational physicians. So like we're at universities, there's a lot more resources there. And we have someone that presented with me at the Hopkins ERC in March is an epidemiologist at the Bloomberg Public Health Center at GW. So we do get a lot of resources now. None of us have really had terrible concerns from exposures, but within our community, there is concern. People do wonder whether the cancer they developed was related to the work they've done, whether other health concerns that built over time are related to their profession. So it's hard to say, but we're trying to, I think, educate ourselves, and we really do need help in this to understand both the chemistry and the biology. And it's taking us time to learn who we need to talk to. It's not just industrial hygienists, it's people with the background in biology as well.
Do you have access to employee health at GW?
We do, yes.
You could go there.
We could go there. But again, it's, within, especially nowadays within university structures, with a lot of recent events, things are getting contracted to some degree. So even if you have those structures in your workplace, you may not have all the resources you need. So that's where we're trying to build networks within our community. Other people are trying to, someone that presented in our series just this week is in private practice as a private conservator. She's trying to build a network pairing conservators in private practice with industrial hygienists in private practice or in consultancies to build up these networks of resources. So if someone has a problem in southeast of the United States, they can be routed to different teams. But yeah, we need help. We do need help, especially on the biological end, I would say.
Fusco, this is very enlightening, at least for me, about you did such a great job describing the hazards associated with this rather unique industry. My question is with wool sorters disease, drumheads, has anthrax ever been presented as an exposure issue in museums?
That's a good question. Yeah, I've sort of wondered about that recently because there are. Well, I mean, I wonder with archaeologists excavating materials. I'm a little ignorant of the biology on that end, but there are collections with hides and animal skins and coverings and furs. I've had that concern abstractly, but I don't really work with these collections a lot. But I would say it's worth adding to the list. And the more we can make a list exhaustive, the better. I mean, until I met our colleague David Goldstein in public health at GW, I was a little ignorant of silicosis as a risk factor for certain types of art conservators and archaeologists. The more you learn, you need to learn more. And talking to your communities, I think, would help us in our community learn just what we're at risk from. So thank you for bringing that up. Thanks for both the questions. You're very helpful.
I was just wondering, can you tell me, you have how big
Oh yeah, I'm sorry. I get a little the hard part for the horse and eyes. So when I would say collectors and museum professionals for a long time, up until about the 1980s, and it still happens, all our collections are susceptible to pest damage. So you may know your wool sweater might be eaten by moths, but that is sort of exponentially a concern with really big collections that are all in one site. And so people often have pest infestations in collections. Moths will come in, carpet beetles, kind of depends on the media. There are insects that eat wood, insects that eat paper. And so people were concerned about the collections being eaten. And so in the past, to protect them, museum people went to the Department of Agricultural and other federal entities, asked for advice, and they were advised to mimic agricultural practices and employ pesticides, spraying either proximate to an object, right on an object. So there's one example you saw in our museum, strips that off gas, so then they used everything under the sun, and this was often not documented. They just didn't have the time and staffing to do that then. And the important point is they thought they were doing the right thing. It was considered best practice at the time, and they did it under advisement of federal authorities. So, but in the 1960s, people started realizing how kind of risky this was, especially with Silent Spring and the publication of that book. People started being more aware, but it still took a couple decades for people to sort of move away from this practice. So our museum used chemicals too, and we documented more than most. And we got away from this practice in, I think it was spring of '88. They started moving to freezing collections rather than chemical practice, but they were getting advice consistently that this was the thing to do. And we're learning more and more how people were spraying paper collections, book collections, things that you would think would be of concern. So it's a bigger concern than I think people in our community know, but we're building attention to it.
Thank you very much. There is an online question, but before I read that question, it's very important question when you prepare for the exam, talking about like pesticide for a museum, and arsenic is one of the, like, if you see it in the exam or prepare for the exam is something that you want to learn and study. We went to Natural Museum during site visit in our FDH, and it was very enlightening. Like, you wouldn't expect to see this amount. New York, like museum, are still don't have, especially the old buildings, they don't have the same, like, they don't cover by the same law that you have right now, because they are built in the 1800s. So a lot of things that they can't export, including like wood and other issues. So how do museums avoid disease transmit when dealing with the human remains that may be thousands of years old? For example, Egyptian mummies and smallpox.
Yeah, very good point. I don't have a lot of expertise here, so I don't know that I can answer completely, but yeah, archaeologists would have a concern here, and then there is a type of art conservator called an archaeological conservator, and they partner with archaeologists with extracted materials and process them, so they're handling. I do not know, honestly, at this point, what kind of PPE they're using, but I've seen such a big increase in the past few years. I've seen more people, just as we're interviewing professionals of past work wearing respirators, things like that. I don't know that much about that, but if anyone's interested, I'm glad to connect them with relevant professionals. There is in LA, UCLA, and the Getty have a joint program where they train conservators that work with excavated materials in particular, amongst other media types. They're probably a good center if anyone has any questions or wants to collaborate. But yeah, I thought this was a very sterile industry I was going into, but it's not. There's a lot of risk factors, and we're just trying to. I feel an abundance of responsibility to keep my staff safe, and then with repatriated items, especially, just to make sure that at the least risk is being communicated, but that things are being done to make amends where possible, and the swath of people affected, it just keeps widening, and especially in museums of education collections, and people are interacting with them as well. So I would say a public health crisis is a good way to determine.
Thank you very much.
Yeah.